I think the easiest way to explain the role of a physiotherapist is that we work with people of any age or ability to move as best as they can. Usually they'll involve an assessment to help them work out whether it's things like strength or balance or coordination that's impacting their movement the most, and then try to improve those things. Often just having a conversation and helping them set goals can be really helpful as well. Falls prevention is massively important. To put it in perspective, falls are the #1 cause of injury-related hospitalisation and death in Australia. As you might expect, older age people are significantly more at risk. This is usually due to a reduction in balance and strength in older age people, which are key risk factors for falling. There's actually a lot, which is why I think it's good to talk to your GP and physio as the first step. Usually when I'm talking about risk factors though, I like to break them into a couple of categories just to go through them logically. First, I'll say that there's things that are intrinsic, which is things about you personally, biologically, and then things that are extrinsic, which is to do with your environment and the activities you like to do. Intrinsic risk factors would include things like being older, being female, having poor muscle strength and endurance, reduced balance, things like your vision, having low blood pressure, just to name a few. I also like to think about things like bone density, because that can increase your risk of having a fracture if you fall if it's low. Extrinsic factors would be things like your furniture, the layout of your home, the footwear you use, and the kinds of activities that you like to do. The next step is then looking at those risk factors and working out which ones can we actually change. Looking at some of the risk factors we've already discussed, some things such as balance and your home layout are things we can definitely change. And it's these sort of things we want to focus on. Obviously, there's some things you can't change, such as your age, but it's important to understand how these influence your risk, and it can help build the case for taking a measured approach to your falls prevention. To finish up April Falls, join us next week to see what a session to improve strength and balance looks like.